All right, we'll go ahead and get started. Thank you all for being here for our Wednesday COVID-19 media briefing. You should have just gotten an email regarding seniors that Kevin's going to talk about regarding jumping to the 65 to 69 age group. I'll post it in the chat here in a second if you haven't gotten it yet. I also wanted to just give an update. If you're looking to get B-roll from the pod, we do have some options available from outside, kind of where the vaccines are being administered, and also of the waiting lot if you're concerned, if you're interested in that. So just reach out to me, and we can update some of your B-roll if necessary. With that, I'll pass it along to Kevin Dick for his weekly update. Kevin, take it away.
Yes, thank you, Scott. And as Scott mentioned, we did put out a press release just a little earlier, and that's announcing that we are going to begin vaccinating those individuals in our population that are 65 and older through the pod that we have at the Reno Livestock Event Center. So we will be opening up that for those individuals to be able to get vaccinated in our drive-through pod, as well as the other locations in the community that are providing seniors those vaccines through pharmacies. And Renown also will be moving that to 65 and older, I believe. We have called and emailed invitations to about 10,000 seniors this week. That were 70 and older. So we have contacted all of the individuals through phone or email that were 70 and older that were on our list for them to be scheduled for vaccinations. So we are moving on now to the 65 to 69-year-old age group. And we'll start sending those email invitations soon to the people that have signed up onto that waiting list that we have for 65 and older. So a reminder to everybody to check email boxes, look for potentially an email that landed in your spam folder if you are 70 and older, to make sure you take advantage of that opportunity to get scheduled now. And in the future for those 65 and olders to be look for those emails. And there still is the opportunity to get signed up on that wait list on our website. You'll see some more information in that press release that went out. As far as our COVID-19 status, well, this week on Monday, the nation passed a stark milestone of over 500,000 people that have died of COVID-19 since this pandemic began last year. And sadly, we are at 640 people that have passed away here in Washoe County from COVID-19. It's been nice that for the past 3 days, we haven't reported any additional deaths. So we hope that we continue to see a reduction in the number of deaths that we're reporting. But it's a huge impact that we've had both here in Washoe County and across the nation. Many grieving families for those lost ones to COVID-19. Yesterday, we reported 102 new cases, which is the most that we've reported since February 5th. So that was somewhat disturbing to see that number. Our 7-day average had gotten down to 34.3, the 7-day moving average on Monday. That's the lowest that we had seen since June 22nd. However, with the numbers that we reported yesterday, that reversed that trend. And our 7-day moving average as of yesterday was up to 45.3. So we don't know if this is a Super Bowl bump that we're seeing from gatherings that occurred then. We also had a large number of test results that were reported yesterday. And so it may be attributed to something with the way things cycled through the labs. But we'll be watching our numbers and are concerned that we may have bottomed and hopefully we're not climbing again. We did this week have the first week in quite a long time that we are not flagged for elevated disease transmission for Washoe County. The test positivity rate has continued to decline, and it went below the state's threshold of 8% this week. And so we're no longer flagged for both the number of new cases per 100,000 over a 30-day period and our test positivity rate. As of today, that test positivity rate has continued to decline, and it's down to 6.4%. So that's encouraging news. And even with a large number of cases that we reported yesterday, since it was a large number of test results that we also received, we don't feel that that's going to be driving our test positivity rate higher. So that's a good number to be seeing, and we hope to see that continue to decline. And as I said, I hope this is a blip that we got yesterday, and we can resume a reduction in cases occurring. But we still need to continue to be vigilant with the new variants that we know of, the UK variant in California and Las Vegas that's been confirmed, and with the South African variant that's been confirmed here. We know that we have the potential for variants that can be transmitted more readily, as well as potentially having more morbidity and mortality associated with them. And yesterday, there were articles as well that were published regarding some studies looking at the variant that's occurred in California with the potential for more transmissivity of that as well. And we know we have that one in the area here. So between that and with the loosening of restrictions, we need to really continue to be vigilant to wear masks, wash our hands, watch our distance as we move forward, so that we can continue to make progress and have our economy functioning while we're continuing to reduce the spread of that transmission. The Johnson & Johnson vaccine has gone to CDC and FDA approval for approval. And the results are that it is effective, and it's about 66% effective. But that's lower than the Pfizer and Moderna. But the very important thing to recognize is it's effective in helping to reduce the severity of the disease, the number of people that would be hospitalized and potentially passing away. And so it's nice that we have the potential for a third vaccine in our arsenal. It'll be going through further review over the weekend, and so we expect to have an announcement soon about whether it receives the emergency use authorization. We anticipate that it will, and that we will begin receiving some shipments of it shortly after that. And the advantage with that Johnson & Johnson vaccine is it's a single dose vaccine. So it is not as complicated with the administration and requiring that second booster. So we'll look forward to how this evolves, and hopefully we'll have that third vaccine available to us soon. That's my briefing for today, and I'd be happy to take any questions.
Thank you, Kevin. Go ahead and ask Kevin your question, or type it in the chat box and I'll read it out loud.
Hi, Kevin. This is Paul Nelson with 2 News. How relieved are you that you're now moving down to that 65 and up group to people that can now get the vaccine?
Well, it's great to be able to see progress in moving through the lanes of the state's playbook. And we know that the 65 and older are also a population that is affected more severely with COVID-19. So it's great to be able to expand that down into that category and give more opportunities for people to receive the vaccine. I did want to mention, Paul, the state did post updated vaccination numbers for Washoe County today. And so we're at 107,425 doses of vaccine that have been administered through the county as a whole. And so that's 14.48, so about 14.5% of our population has received the first dose of the vaccine, and 7.93 or almost 8% are now fully vaccinated. So we are making progress, and we're continuing to see some increases in the amount of vaccine that's being distributed to the state and to Washoe County. So that's encouraging as well. And we continue to welcome more vaccines so that we can accelerate our rate of being able to get people vaccinated.
Got a question. Benjamin Payne with the Sierra Nevada Ally. There are a lot of essential workers who are not employees of a company, but they rather work as independent contractors or gig workers, like people who shop for groceries for others through like Instacart, or who deliver food through DoorDash. Is the health district letting them get the COVID-19 vaccine at this time? And if not, why?
We are not yet into that next essential worker group. We're still finishing off the community frontline workers that are providing services to the neediest in our community, and so we're wrapping that essential workforce group up now, and we're making plans for the next group, beginning with the agricultural and food processing, and the end-to-end essential supplies distribution, manufacturing and distribution. And so, Benjamin, what I would recommend is if people are in those workforces, that they contact us to be alerted, so we know who they are and what they do, so that we can get them in our system to be able to alert them when their turn comes up. And there's an easy way to do that. If they just email COVID vaccine at washoecounty.us, with that information, we can have somebody respond to them, and we can monitor them as far as when their group comes up.
And do you know when that might be?
It's going to be a matter of how quickly we get wrapped up with the workforce that we're doing right now, how much vaccine that we get in, and how we work through that ag and food processing down into that distribution. As far as like the DoorDash type workforce, that's going to be further down when we get to food service type personnel. So it's all outlined in the lanes in the governor's playbook.
Okay, thank you.
Hi, Kevin and Siobhan from the RGJ. The district's going ahead with sports, and there's football. They're going to test football team and coaches, but not some of the other sports. Should they be testing all the athletes, like volleyball, swimmers, every track and field? I think they're just going to test football players is what we're hearing. Should there be universal testing of all athletes?
Well, I think it's a decision based on resources available for that. And as far as where to focus that testing, the resources are limited. I think it is appropriate to focus on the football players, because that is a contact sport. And that's the recommendation that has come out through the governor's directive for those contact sports to have that testing program in place. It would be nice to have other testing available, but there's a resource question there as well. And so I do think it's appropriate to focus, as the recommendation has been made, on the contact sports for the testing.
What are the other so football? So soccer's not a contact sport. Is there any other contact sport?
Not in the spring season, I believe. Wrestling and basketball are considered contact sports.
Thanks.
And on that note, with sports, do you have any preference on how many people can be at the game? How many spectators can be at these games?
Well, we haven't really gotten into that work yet. The it's a matter of what kind of plans can be put together and what kind of fixed seating is available to manage those crowds. So I know that the school district just made the decision that they wanted to move toward fans at those sports events, and we'll be working with them and looking at those plans as they're developed.
Would you still, with knowing what you know now, this is Siobhan again, do you think there's any chance of having any kind of normal graduation ceremonies come June? I know the district's still deciding that, but last year it was drive-through ceremonies and things like that.
I would say that the prospects of anything being normal in June, whether it's graduations or anything else, are still quite remote. I just don't think that we're going to have move forward with the vaccinations and be at a point with our cases and number of population vaccinated for anything to be normal that soon.
Kevin, Scott Sauter at AP. Yesterday on the Truckee Meadows COVID meter call, there were a number of people who said they are hearing good things about the acceptance rate of people taking the vaccines who could get them, but there was some concern about as we move down into lower ages, especially as we get close to the general population, that there may be more reluctance. Do you share any of those concerns? What are you hearing about that? And what are the primary concerns that people have? Is it efficacy or is it side effects? What are you hearing in that regard?
Yeah, I don't know that I have a good answer for you there. I think we've seen our experience has been that there's been quite a demand. There are a lot of people that want to get the vaccine, but I haven't been involved in those conversations with people about why they aren't getting the vaccine. I guess I would point you to the work that Dr. Riddle has done at UNR with the surveys that he's done to assess the people's desire to have the vaccine or hesitancy that they have around receiving the vaccine. And it's, some of that is kind of interesting in how, world viewpoints, I think, and kind of shape who seems to be more reluctant to receive the vaccine than those that are eager to get it.
Hi, Kevin. Terrell Wilkins from the RGJ here. I had a pretty simple question, but I was wondering how the rodeo coming back in June at the Livestock and Event Center will affect testing or vaccination operations there.
Yeah, thanks, Terrell. We're aware that the rodeo wants to get, or the whole Reno Livestock Event Center facility would like to have more events resuming and activity there. And so we're working along with the incident management team for the region in assessing some different locations for potential relocation of the drive-through pod that we've got at the Livestock Event Center now. So we're working to develop alternative plans to be able to make that area available.
Got it. Thank you.
And just to piggyback on that, you said nothing will be normal in June, but except the rodeo, right? I mean, the rodeo comes back, like you said, don't expect anything to be normal in June.
Well, the rodeo hasn't had any conversations with the health district about their opening up sales for that event in June, and they don't have any approval for that event at this point. So I don't expect that the Reno Rodeo is probably going to be looking normal in June.
Thanks.
Hi, Terrell Wilkins again. I was just curious what if you knew what some of the other options were for places outside of the Livestock Event Center.
Terrell, I don't want to comment on that yet. They're all kind of in the the assessment and development phase right now.
Okay, got it.
Hi, Kevin. This is Laura with Reno Dia, Laura Calzada. And more than a question, it's a comment. I've seen a lot of people not wearing their masks anymore. I don't know if because the numbers are low or because they think the risk is not there or because the governor is easing the rules. So what can you comment on that?
Well, thanks for bringing that up, Laura. I think what we've seen from our regional enforcement efforts as well has been some backsliding since the governor's announcement of the easing some of the restrictions on occupancy, et cetera, and a misunderstanding that seems to be out there that there's an easing of the mask wearing requirement. And that's not the case. The mask wearing is still mandatory, and it's still essential for us to continue to reduce the spread of the disease. And unfortunately, I think we have a tendency in some parts of our population that when they see that the state is allowing things to happen and things are opening up a little bit more, that it's all right for them to drop those precautions that they've been taking. And nothing could be farther from the truth. That's when it's really more important for us to continue to follow those practices so that we don't have a flare-up happen as we're opening things up more and we have more people mixing together.
Thank you very much, Kevin.
Do you think that, I believe it's next Monday, when restaurants and facilities can go back to 50% capacity, do you think Washoe County is ready for that?
Yeah, it's actually going to be the 15th of March is the date for that 50% capacity. And I think what we'll do is continue to watch our numbers here locally, as I know the state will be watching them across the state as far as whether to move forward on that schedule for the 50% occupancy.
Any other questions for Kevin? Okay, thank you, Kevin, for addressing those questions and for the update. Thank you to all media for being here. We have recorded this and it will be on our COVID-19 Washoe site here pretty soon. In the meantime, if you have any further questions, feel free to reach out. Have a good day.